Why the word medicine in fetal medicine?
We are not offering direct treatment in every case, but there are some cases wherein we also offer the treatment to the baby. And most of the times I have heard people saying why it is important. See, because now in the era of IVF, we are facing more and more number of twin gestations, triplet gestations.
Ooh.
I have seen many patients, they have not paid attention to the baby movements, and then we have seen grave results of this. So it is always a team of doctor who is looking after you. All in all, a fetal medicine specialist act as a chariot to the treatment of the patient and act as a magician in the field of obstetrics.
Welcome, ma'am. Thank you for taking out time.
Thank you so much for inviting me here.
So before we continue with the domain and the area where you operate, and then technologically what's happening there and where is it that Rising Medicare is working, I would love to know more about your journey. How did it all start? And one question specifically is, why did you decide to build your authority in this domain, or specifically choose this domain amongst the whole ecosystem of gynecology?
So first of all, to introduce myself, I'll let you know I'm Dr. Shweta Giri. I'm practicing at Rising Medicare Hospital, Kharadi, and I'm a fetal medicine expert. So regarding my education, I completed my education in Mumbai, the undergraduate education as well as postgraduate education, and then I shifted to Pune. So initially I was just practicing as a plain radiology practitioner, but then later on in few years I understood that doing only this will not be enough, and it will not be justice to my patients who are coming to me with all that of faith. So I just decided to shift my focus towards the fetal medicine perspective, and I started this practice since more about 8-9 years now.
Okay. So let's talk more about fetal medicine, right? What is it? What does one do? And what is the core principle of this entire segment of medicine?
So fetal medicine is a branch which is in which we evaluate the fetus like anyone would do, but we add a different dimension, a different perspective to each of the finding that we get during the scan. So we study a lot of data, we study a lot of images, we study each and every structure, the embryology, and then according to that we assign perspective so that the patient gets benefited the most. So that is how the fetal medicine is a better choice for any person who is expecting.
How does it help expecting parents?
So as I told you, fetal medicine adds an entire new perspective to every finding that we get. For example, if we come across a smallest finding which is called as polyhydramnios, wherein the fluid level in the womb is increased. What a conventional radiologist would do, the conventional person would just report that the fluid level is increased and it is this much, and then will tell the patient to go to the clinician and to consult. But what a fetal medicine expert will do, will try to find out the reasons because of which the fluid level is increased. They will see if there is any defect in the fetal lips or in fetal palate, which we call as cleft lip, cleft palate, which can hamper the swallowing of the baby. If there is any obstruction in the stomach and duodenum because of which the fluid is not going down. And also if everything else is normal, if the sugar level of the mother is normal, because even the smaller findings such as increased sugar level of mother can cause increased fluid inside the womb. So if the GTT, the glucose tolerance test is done or not, if everything else is normal, has the patient increased the sugar intake in the form of food? So you have to assess everything and then tell the patient, you have to guide the patient. So all in all, a fetal medicine specialist act as a chariot to the treatment of the patient and act as a magician in the field of obstetrics.
Why the word medicine? Because अभी तक जितना मेरे को समझा, it's purely around and about testing and then finding out diagnosis or preventive care that you can add, right? So why the word medicine in fetal medicine?
Most of the times when we assess the pregnant women, we forget that baby is actual patient to whom we are assessing. And how do we assess a baby? How do we? So though it is not a term of direct treatment, we are not offering direct treatment in every case, but there are some cases wherein we also offer the treatment to the baby. For example, we can reduce the liquor amount if it is required. We can give intraamniotic transfusion to the baby if the hemoglobin of the baby is less in certain conditions. We can reduce the number of fetuses if required.
Okay.
So all this can be done with the fetal medicine. That is why the word medicine is there in the fetal medicine.
Understood. So I'll just try to understand this a little more deeper and better. Say you did a test and you found some unusual either activity or some abnormal behavior of the fetus, right? So what are the next steps that you take? What happens after that?
So basically, we have to run a series of tests in such case. For example, if I am to explain you about NT scan, which is a very crucial scan done during the pregnancy, during the 3rd month of the pregnancy. During this scan, we basically assess the translucency behind the fetal neck. Okay. And then if the translucency is normal, then there is maximum chances that the fetus is going to be normal. But in some cases, if the translucency is increased, the NT is increased. In that case, we tell the patient to go for certain test.
Okay.
For example, there is test called as NIPT, which helps us to determine whether the baby is having chromosomal abnormalities. If that test is normal, then we can proceed with another test which is called as amniocentesis, wherein we remove some fluid from the womb and we give it for the testing. So depending upon these tests, then we decide whether the problem is actual or if there is any other problem, because abnormal NT is not just due to the chromosomal abnormalities. It can also be due to cardiac abnormalities. It
Correct.
can also be due to skeletal abnormalities. So if everything else is normal, then we have to also check in 18-19 weeks, we have to also check the baby for the abnormalities, if there is any progressive abnormalities which are happening in the baby. So everything, it is not just one test, you have done it and it is done. You have to go through it all the time. Every time you're seeing the baby, you have to check for everything.
When should an expecting couple consult a fetal medicine practitioner?
So to tell you, as soon as the pregnancy is detected, the couple can take the advice of fetal medicine expert. So the first sonography that we do is around 5 to 6 weeks, and most of the times I have heard people saying why it is important. It's just you would be seeing nothing. It is just so small. Correct. But let me tell you, that is not the case.
Okay.
Because the first and foremost important thing that we assess during this time is where exactly the pregnancy is located, whether it is located inside the uterus or whether it is located outside the uterus. So actual location we have to find out. Importance is that because if it is ectopic, in that case we have to take early steps. Right. And then in case if it is situated inside the uterus, then how many fetuses are there? If it is singleton pregnancy, because now in the era of IVF we are facing more and more number of twin gestations, triplet gestations. Ooh. So for that, how many number of fetuses are there? And then also we need to check whether the pregnancy which is there is corresponding to the date of the menstrual age of the patient, because these two are the different concepts. So sometimes even if the menses are regular, then the pregnancy usually has to be of that similar age. But Understood. If the menses are not that regular, then the pregnancy can be smaller than the menstrual age. So we have to check everything and assign a date to the fetus, like this is going to be the expected date of delivery, and accordingly we have to monitor the baby with the same reference date. Yes.
Information ka zamana hai. There is information everywhere. Practically people check on the internet first and then they'll go and probably speak to a doctor. In this age of information, one notion that a lot of expected parents have is they will do multiple tests, of course, as recommended by the doctor, but they would prefer to do it at multiple centers or doctors. Is it good? Is it bad? How should one approach this whole process? Because this gets overwhelming. I'm also a father of a 13-year-old daughter, and I remember clearly कि जब when we were expecting her, हमें बहुत लोग बोलते थे यहाँ करवाया अभी यहाँ जाओ, यहाँ करवाया अभी यहाँ जाओ. So what is it like? Is it good? Is it bad?
So it is always a team of doctor who is looking after you, and they are used to work in a team. Like it is your obstetrician who is looking after you, it is your fetal medicine expert looking after you, then pediatrician, geneticist. So they are always in communication about your case. So anything, if there is anything, any need of any intervention, then they would let each other know. But when you don't, you go to different places for the same test or for the different test, then it actually causes some kind of obstacle in your optimal management. That's what I feel.
Right. One thing where there is not a lot of clarity is the advancements in technology and the whole procedure, right? If I were to give an example, IVF के बारे में लोगों को पता है, बट IVF के अंदर इतने सारे मोडालिटीज़ और मोड्स ऑफ ऑपरेशंस आ गए हैं और इतनी सारी टेक्निकल एडवांसमेंट्स हो गई, पीपल जनरली डोंट नो अबाउट इट. They will go to one place and then either they'll explore multiple places or they'll just stick to that particular point, right? So in fetal medicine, what are some latest technical advancements and modalities that have come in जो expecting parents को उनकी जर्नी थोड़ा ईज आउट करेंगी, थोड़ा उनको कन्वीनियंट करेंगे, एंड एवरीवन शुड बेसिकली नो अबाउट देम?
A lot of technical advances, and they come every other day. And to tell you the truth, and which may not be the one which you would feel would be the truth, but it is more about more than the technical advances. Yes, technical advances make you at ease, they reduce the scanning time, they show you particular things little bit earlier than the other ones. But the most important thing in fetal medicine is your expert. It is the man behind the machine who makes more sense than any other technologies.
Correct. How does one find such consultants or practitioners? What is the criteria? Criteria is not the right word, but क्या देखना चाहिए मेरे को? So if I decide कि हाँ ठीक है, I mean I'm going to start with this doctor, and मेरा भी जो भी diagnosis होगा, testing होगा, it'll happen here. What should I be looking for as an expecting parent?
You can be looking looking for the qualifications. You can also look for the experience, number of years that person has spent in the particular field. You can also ask for you can also look for the Google reviews. You can also ask your friends. So I think that should be helpful.
Great. Ma'am, you mentioned that there's always a team that's working to take care of a patient during their pregnancy. How does that teamwork evolve? How do all the 4 different domains work together? Like you've got a gynecologist, you've got fetal medicine experts, you've got obstetrician and pediatrics.
So basically, initially, your obstetrician and your fetal medicine expert are continuously in touch about your case. If there is any problem, then comes the role of geneticist, and then we discuss the case with the geneticist. If required, we also send the patient to the geneticist for further consultation. And then after that, if the baby is having certain problems, for example, if the baby is having some obstruction in the kidney and that is causing swelling on the kidneys, in that case, the role of the pediatrician will come. The pediatrician will counsel the patient before delivery regarding the case, what could be the scenarios, what will happen in this case, how we will monitor the baby after the birth, and then if there is any need of any expert care immediately at birth. So that is how it goes. So initially it is always obstetrician and fetal medicine expert, and in abnormal cases specifically comes the role of geneticist and pediatrician. because otherwise the pediatrician would see the baby after birth.
There are many different scans an expecting mother has to go through. That gets overwhelming.
Yeah.
You practically going from test to test to test to test. कई बारी वो स्ट्रेस भी आता है, राइट? आई रिमेंबर व्हेन वी वर एक्सपेक्टिंग, बहुत टेंशन आती थी, आज ये टेस्ट है, वो टेस्ट है, एक दिन में 3 टेस्ट हो रहे हैं. So there are some people who just get really scared about and for those tests. But I would like to understand from you, okay, what is number one, the significance of having so many tests? And then how do they really help throughout the pregnancy journey?
So each and every institute and each and every doctor have their specific protocol of testing during the pregnancy according to their expertise, according to their experience over the year of time. But there are few tests which have to be done, and we cannot just say we do not want to do it. So the first scan, which we do at 5 to 6 weeks, which is also called as dating and viability scan. Then the second scan is done at between 11 to 14 weeks, which we call as NT scan, in which we check if there is any sign which is showing abnormal NT, which can lead to chromosomal problems later on. Then the third scan would be animal scan, which is done between 18 to 20 weeks, in which we check the entire structure of the baby, along with the growth and liquor and the placenta, everything. But mainly we check for the entire structure of the baby in animal scan, and it is very, very important scan. Then the fourth scan is fetal echo, wherein we check the heart structure of the baby. And then the later sonographies are done usually 28 weeks, 32 weeks and 36 weeks to check the blood flow, the growth of the baby, the fluid. So these are the routine sonographies. But the initial sonographies are very, very important. And the later sonographies also, during this particular time, maybe you can reduce a bit, maybe you can reduce like from 3 to 2 or maybe 3 to 1. But yeah, they are important because they can find out if there is any need of intervention during this pregnancy, if there is any need of delivery, early delivery, or
Okay.
the patient if is needing some more medications or more treatment. So for that, these tests are needed.
And these early tests will also help, as you mentioned, you determine about the timeline of the pregnancy, and then if at all there is a possibility or a requirement for an early delivery.
Yes.
These early tests let you do that, right? So
Yes.
during that process, what are some early signs that you look out for, which tell you, that the baby is fine, and everything is as per the normal natural process? And what are some signs that an expecting mother should look out for while throughout their pregnancy, basically?
Yeah, so to rest assured, any couple can look for a few things like how is the growth of the baby, whether it is corresponding to the date assigned to the baby. Then whether all the structures are checked during the sonography and whether they are normal. How is the placenta? How is the cervix? Cervix is the uterine mouth, whether it is normal in length. And in later pregnancy, how's flow to the fetus. So if everything is normal and it is mentioned in the scan, then the couple can rest assured that this pregnancy is a good pregnancy.
Got it. Just a moment. And then what are some warning signs that one must look out for?
So the warning signs can be, as we all know, first is bleeding. Any kind of bleeding in pregnancy is not normal, and we have to visit your doctor if bleeding is there. Then there could be any pain in abdomen because that can be early indication of preterm delivery. Then any increase in weight, to be precise, more than 5 kg in a single month is abnormal.
Of the mother?
Of the mother, yes. Then reduced movement of the babies can be abnormal.
So I want to build on that point, right? There can be times when a mother feels that there's no movement of the baby.
Yeah.
Should they be immediately coming and consulting their doctor, or is it natural that the baby may or may not move sometimes? How soon or how delayed the action should be
So, baby movements are such that every mother knows when my baby moves the
Correct.
most. Yeah.
Yes.
So some babies move in the morning, some babies move in the evening, some at night. So every mother knows. So she has seen the cycle of the baby movements. So if there is any change in this cycle, like the baby has not moved for more than 6 or 8 hours in a day, not you have not felt so much of movement, then I think they should consult the doctor in that case, because most of the times the baby movement are reduced because of some kind of fetal distress. Yes, in most of the cases it could be the sleeping cycles of the baby, but we cannot always think that this is just a sleeping cycle, because what happens is this is I have seen many patients, they have not paid attention to the baby movements, and after they have come after 2-3 days not
Oh
paid
God.
any importance to this finding, and then the we have seen grave results of this. So baby movement always is very important, and you can also, I mean, to simplify, sometimes the baby always moves after each meal. So if
Okay.
you're working and it is not possible for you to look for baby movement all the time, then you can just check for the baby movement after each meal. If the baby is moving 5-6 times, then that should be enough. But then this has to be done after, say, 6 months. You have to monitor the baby movement, and it is very important.
Understood. So now I'm coming to Rising Medicare Hospital. What are some initiatives or what are some technical methodologies that Rising Medicare has put in practice to ease out, expecting parents ka journey? What happens? What are the processes? And then I have one more follow-on question, but I'll let you answer this, and then we'll move on to that.
So we have a fixed protocol of scans during the pregnancy, as we have mentioned before. Along with that, we also have made sure that we follow the ISCOG guidelines for assessment of the pregnancy. We also have the prenatal screenings, which are there. They are in the place, and also after birth we run the certain test of the baby, which helps us to be sure that this baby is a normal baby.
Got it. Now, the follow-on question that I was talking about, right? So, Rising Medicare has this very patient-centric, patient-friendly, patient-focused approach. That stems from a lot of care, a lot of empathy, and a lot of emotion. When you are there, how do you? What are some things where you add those emotions, and how do you, sort of coach your team also to follow this service first, empathy first culture while working with patients?
So I've always seen every patient who comes to the hospital is always into distress, some kind of distress. Is always, they are anxious, they are feeling what next.
Correct.
So first and most important thing is greeting the patient very empathetically. Smile to the patient, it takes their half worry away. And then communicating, the communication I think is the most important thing. Whatever the findings are, whatever whatever the treatment protocols are, we have to communicate that to the patient in the most gentle way, and also at the same time we have to be very transparent while communicating everything. We cannot just say देखेंगे करेंगे. You have to put forth all the possibilities in each case.
Correct.
And then at the same time, you do not have to scare of the patient that पता नहीं आगे क्या होगा,
आगे
अभी
क्या
तो
होगा?
डॉक्टर ने इतना कुछ बोल दिया है. So you have to balance everything in that way, so that the overall experience of patient is far good.
One last question before I thank you for your time. Rather, there are two questions in one. One is, what are some things that you have introduced at Rising Medicare, which sort of build and help your team also and help the patients also, approach this entire journey with a lot of empathy, compassion, and care. Number one. Number two, what is your long-term vision about and around fetal medicine?
I introduced fetal medicine in the Rising Medicare, being a
Oh,
founder
okay.
member, and then I've started the practice of fetal medicine first in the Rising Medicare. And accordingly, we have developed the designs, approaches, protocols to help the patient to ease out their treatment. And regarding vision, I really think that my every present moment, whenever it comes, I would make sure that along with me, even the team of the Rising Medicare takes a good care of the patient to help them ease out their worries and to get a good outcome in their pregnancy.
Great, great. Thank you, Dr. Shweta. This was indeed a good conversation. Thank you for your time and look forward to the next one.
Thank you.
Thank you.